Welcome to the 6th Annual Soilcraft Conference. Join us as we listen to world-class speakers in the space of regenerative agriculture, as well as human health. We grow food. Food should nourish us, and often we find that our modern food is laden with unwanted synthetics or void of the minerals and vitamins we need to thrive. We endeavor to host this conference for your inspiration and education. Our calling is to help you produce food that heals people and our planet. Join us in this journey to become better stewards of our bodies and the world we abide in.
And again, here's where we get affected. The gut system gets affected because my gut wall is collagen. If my collagen wall breaks, I don't have that real strong bonds in my collagen and my gut wall. I get what they call leaky gut. Anybody heard of that before? I have to leak the food through my gut wall. I have to leak the food through my gut wall to have a response to it. Now, I'm supposed to live on, what's your body use for fuel? Flex fuel vehicle, fats, carbs, and protein, right? Fats, carbs, and protein. You want to be a carnivore? I don't care. Go ahead. You might be healthier. You want to be a keto, lots of veggies and lots of meats? Great, go ahead. You want to eat all carbs? Good luck. We run on fats, carbs, and protein to build our body back up. But if I leak through an undigested protein in my bloodstream, you know what happens to it? Right there. If I have an undigested protein, let's call it gluten. Everybody's gluten. Egg white, dairy, oh my goodness. When it comes through the gut wall, and it's not just amino acids, because I want to build my body back up with amino acids. Glycine, lysine, proline, histidine, you keep going, glutamine. That's how I build my body. But my body does not like gluten in the bloodstream. It doesn't like egg white in the bloodstream. It doesn't like milk proteins in the bloodstream. Because if it gets there and it's not broken down into single amino acids, my body's going to say, what are you doing here? I don't know who you are. You could be a pathogen. I'm going to tag you and don't come back. So I make an antibody to it. Does that make sense? And then every time I eat it, it comes back, and finally I get mad and go, okay, that's it. I'm bringing the troops in here. And now you get a long-term allergic reaction to that protein. Does that make sense? This is what's happening today. One quick thing that also happens is if the glyphosate comes in the body, it knocks out a good bacteria, but it feeds C. diff, salmonella. It actually feeds the bad bacteria. 30,000 people a year die from C. diff. It's called the nursing home nightmare. It'll dehydrate you and kill you. Gives you watery diarrhea. So what have we seen over the since 91? Inflammatory bowel disease is going up. Celiac disease is going up. Oh, I like this one. Let's just throw this in here. I guess this is the cow talking now. I guess it was after I started abusing antibiotics that I noticed 4 extra teats. And it's an interesting thing here. You see the antibiotic use almost overlaps with the glyphosate uses in the body. Isn't that interesting? Because we lose our gut biome, we lose our immune function, and then there's more antibiotics being used in these spots. So there's an emotional component too. I'll get this real quickly. The gut-brain connection, what we make here gets used here. Does that make sense? Everybody following that so far? So when I block that pathway, the shikimate pathway with these bacteria, I block phenylalanine, tyrosine, and tryptophan. That builds my serotonin, my GABA, and my dopamine in my body. Serotonin, I feel good about myself, my life, and the world. Dopamine, I feel motivated. I want to get up and go do something every day. GABA, I can relax in the evening, fall asleep, and have a calm mind. If I lose these building blocks that my gut bacteria are making, I run low on neurotransmitters. Does that make sense for everybody? If you don't have the building block, you can't build the end product, right? That's just how it works. Vitamin K is in there, folate's in there. That pathway, we're not going to go into pathway stuff because you guys don't want to talk about that. So when I have lower building blocks, I have lower neurotransmitters. And what's our answer in this country? Drugs.
Hey, Dr. Allan.
Yep.
Dr. Allan, go ahead, take another 10 minutes. This is really good stuff. I don't want you to feel rushed. We have a break after this.
Okay.
So obviously, if
is everybody okay?
Yeah, people need to get up. This is really interesting, so don't feel rushed.
I don't have any good jokes, so I'll just entertain you a little bit longer. Okay. So here's what happens. If my gut system's not working, I don't have the building blocks for my brain, the gut-brain connection, And you walk in and you say, hey, doc, I feel kind of down today. Well, I got some Wellbutrin here. I got some Cymbalta here. And I'm not knocking it because there are people out there, and I've seen them, they need something like that. There is a chemical disconnect in their body. It's genetic. Look through their family. It's there. They might need a little bit of help. But it's gotten a little bit ridiculous because we spend about what year was this? 2009. It was $4.5 billion on drugs to control how we feel. And that was 217 million prescriptions in 2009. What do you think of this today after COVID and isolation and you're a bad person, you're a good person, and the country lasts so many, you know what I'm saying? It's probably doubled that right now. And here is Xanax, Lexapro, Zoloft, Prozac. Yeah. So what do they say? Well, I'm having trouble concentrating. I lose my thoughts, going room to room. I had one guy, he says, I think I'm in the hereafter, one of my patients. I said, what do you mean you're in the hereafter? Did you see Jesus? He says, no, I get out to my garage and I go, I don't know what I'm hereafter. I got to go back in the house. Anybody done that? Come on, I've done that, right? The hereafter. I feel depressed about my life and I have a great life. I have a great life and I feel depressed. Isn't that crazy? I yawn all the time and I can't stop yawning, you know. So again, clinical findings that low energy in the brain, low energy in the tissue. Sometimes it's Lyme, sometimes it's a parasite. If I'm pushing out my good bugs all the time, the bad bugs show up. And we call a bad bug a pathogen, right? I've never seen a parasite give anything great for the body. Most of the time it's stealing from the body. Quick review of the brain. The brain is 2/3 fat, 25% cholesterol, 25% cholesterol, 25%. You need cholesterol, okay? That's not the enemy. So again, we have neurons in the brain, but we also have glial cells in there, microglial cells. The microglial cells are our protectors. They're the ones that are the defenders of the brain. That's your immune system in the brain. The glial cells are supposed to continually glue the body together, that's what they thought, but really what it does is it actually is and the astrocyte cells are repairs of the brain. And what we're seeing today is chronic toxicity in the body or in the brain causes chronic inflammation in the brain. Okay? Yeah.
This is happening for animals,
It is.
right? I mean, this is across the board. Nothing's immune to this,
Well, I would.
right?
That would be true for the gut bacteria in the animals. Yeah, yeah.
With their collagen?
Yes. I have a vet friend, and she says, you know, she's been 25 years a vet. She says, yeah, when I first started, and now I do an ACL or 2 ACLs every week now on dogs. They're replacing ACLs in dogs today. Isn't that crazy? And what are they doing? Just running around being a dog. Okay? So, yes, it's happening. So when we as we grow as a little child up, we have to prune all the weak synapses out. Does that make sense? It's like pruning an apple tree. We prune, get rid of all the garbage here. But when we potentially over-vaccinate at one time, and we get the glyphosate in the brain, and maybe even Lyme in the brain from birth over, or they got infected, they cannot make the pruning. They don't prune. So this is they can't prune properly. So this is at birth, 6 years old, 14 years old. So the body's continually trying to prune these pathways. But if there's so much inflammation in that kid's brain, they cut the wrong pathway. And this is a kid with autism right here. It's a swirl. You talk to them, it goes in but it doesn't come out, right? You can see it, they're there, but they're locked down. The most common time I see this happening in a kid is at 3 years old. They go in for their 3-year vaccine. It's a pretty big one at that point. I'm not sure what's in there, but a lot of them will stop speaking and become nonverbal and all kinds of behavioral changes. So, and I asked a medical doctor one time, I said, hey, here's the autism rates right here. You can kind of see what's going on. That's partly from this and probably partly from the vaccine schedule. When I was a kid, I got, 4 or 5. You know what I'm talking about? 1 shot in the arm here. If my kids are on the vaccination schedule, it'll be between 72 and 90 today by the time they're 6. And I asked the medical doctor, I said, hey,
How many?
between 72 and 90, depending on what you're going to do. But they give combo shots, 8 or 10 at one time, right? And so here's it is. So they label you now, right? ADHD, OCD, just anxiety, these kids today. And it's, that's an old graph right there. That one's out. Manning the load, buying up the glyphosate. So the best thing they can do right now is to help you lock it in the system. So humics, fulvics, and clinopilite are good. The latest studies show that sauerkraut juice, raw sauerkraut juice, has 4 bacteria in it that seem to do a really nice job of helping break the glyphosate down so it's not toxic to the body, okay? That was Don's paper on the soggy sauerkraut saga. And I would say once a week for sure, if you're going to do that. It's got to be raw. I don't know in dosage, but probably an ounce a day would be plenty if you did an ounce a day there. So you want to break it down so it doesn't come into the body, okay? That's the first step, I think, in my practice here. And then the supporting and building the collagen back up, we need to put the minerals back in that have been stolen, okay? So I think the trace minerals have become hugely important today, and that's one thing I'm working on. I have a small company. I'll show it to the end. Now, where's Trent? You want to come up for a second, Trent? Take your shirt off. Just one of them, just one of them, not both your shirts there, Trent.
At Soilcraft, we endeavor to do our very best to help you grow crops without the use of pesticides. Why do we do that? It's not only because these substances are toxic and have a direct impact on human health and the environment, but as you see here from our world experts in human health, there are actual downstream impacts, minerals and microbes that no longer serve the purposes they're intended to. That's a huge problem. Stick around as we explore solutions to these problems, and we help you to grow nutrient-dense foods without pesticides.
So I'm going to show you a couple things we figured out. I put together a cream called the Joint Regen Cream. So real quick, when Trent's coming up here, and I'll stop talking and boring you guys. I had a 17-year-old athlete come in last October, and he had just blown his ACL for the second time. Sound familiar? Young kids, same knee, left side. I said, "What were you doing?" He said, "Well, I went up for a rebound." This guy was the 6'1", 210 pounds of twisted steel and peel. Came down, his knee shattered. I said, "Someone take you out?" No, I landed clean. So then what happened? I went in for surgery, ACL, reconstruction, fixed my meniscus, 2 ligaments, 9 months of rehab, and they said, "You're good to go." So I started kind of working my way back into the ball games, starting to play a little bit. He said, about 2 months in, I jumped up for a rebound, came down, nobody hit me, my knee blew apart. Again. Remember, it's 10 times the load. So I'm evaluating him, and his mom's over there. "You need to figure this out. This is ridiculous. All of his friends are hurting themselves." I'm like, "Yeah, I know, I get it. I didn't do it." What are you laughing at? So I'm like, "Well, let me this. So I examined the boy, and I find that he had a little bit of Lyme going on, but Lyme is like driving a pickup truck in Wisconsin for 35 years, never washing it, and running it through every slushy puddle. We lose salt in Wisconsin. And one day you're on the back roads and you hit the frame crack. That's Lyme in a joint. We'll talk about it tomorrow. Glyphosate in your joint is like you're driving around in the springtime, you hit that little pothole on the road, and the car kind of shimmies to the right, and you're like, "Whew, got through that one," and you don't notice it, but there's a small draw to the right. We're going to pick on women now, so it's your wife that did that, right? None of you guys would do that. And come October, you walk around the front of the car and you say, "Honey, did you hit a pothole? These tires are bald on one side." And she's like, "Oh, honey, I forgot to tell you. Yeah, last March, So you didn't get 60,000 miles out of the tire, you got 6,000. When I micro tear a joint, a tendon, and the joint sitting up on the edge of the joint, am I going to get 100 years out of it? No. I might get 10 to 15 because I have no nerve supply in that cartilage, and I'm wearing away on that 10% of that joint surface, and eventually bone touches bone, and my world lights up. I'm in front of an orthopedic surgeon. He says, "Well, I got a cortisone shot for you. After that, we'll give you a little bit of replace that for you." That's not the answer. So where's Trent? So anyway, we figured out that this young boy had a copper deficiency in his joints. So he wasn't making energy on that pathway. Remember the conduction? And he wasn't cross-linking. Come on over, Trent. So which shoulder was it? Your left one? Yeah, so let's see if we can fix him up a little bit. So he's got all these muscles on him here. So So I'd already had a product I'd been working on for joints because I saw the problem there, and we had to put glycine, lysine, proline, and manganese in it. And then the copper thing came up, so I said, I think I know what your problem is. I went up front, and I grabbed some copper capsules, and I threw it in the cream, and I said, take this, I'll see you in 2 months, let's get rid of that lime stuff, and let's try to start to stabilize this, and we want to make energy here again, right? So 2 months went by, he came in, and he was starting to stabilize it. When I checked his body out that day, I checked the quad muscle, there was no strength in his quad, and his hamstrings were the same way. So guess what? Every time he jumped and landed, those big muscles that would stabilize it weren't working. So all the load was going to the ACL. Does that make sense? It was driving it to the secondary, and it couldn't handle that load. And the second surgeon said, oh, the first guy did it wrong. I got your solution for you. We're going to fix this right up. So let's go up to your shoulder. He said, had some shoulder problems, elbow problems. Again, push up for me here, push up. So again, I can push through it pretty quickly here. And he's got a little bit of bicep problems. If I check I'm isolating muscles here, bicep tendon. Hold right there for me, Trent, a little bit higher. Push up. So that one's not too bad there. But what I figured out is I'm not going to fix his shoulder up here. I'm going to show you something here quick. So I sent you a little cream a few months ago. He didn't use it on his shoulders. Now I tell my patients, so I'm going to, as I rub this in here, I'll show you what happens here. I said to the kid, I'll see you in 2 months, I'll see you in 4 months. I saw him in 4 months, and I use a vial of ADP to ATP, that conversion there. Can he make energy? And after he'd taken copper orally, a little bit of copper orally, 4 to 6 milligrams a day, and the cream, I went around his body, and I couldn't find any energy deficiency anymore. So now he was finally making full energy. The copper had been saturated back in the tissue. So we used a little bit of DMSO in here, 2 forms of copper, and after that, he was doing really good. So I fixed up the little muscles that weren't working. Came in 6 months. How you doing? Doing great. I couldn't push a muscle on him anywhere. Everything was working perfectly. How's therapy going? Oh, I'm done. Oh, you went 9 months last time. Yeah, I got out in 5.5. I said, how'd you do that? He said I had full strength, full range of motion, no pain. Oh. So I said, come back in 8 months. I'll see you in 8 months. He comes out in 8 months, and he gets up there. He's looking good. I said, I'll see you later. Just kind of keep doing the cream if you want to keep your joints. And his mom had come along all 4 times, and she was a kind of a chronic Lyme gal. And I checked her, and she's 51, and she had the same problem. The joints weren't working. And I said, hey, her name was Vicky. Now, Vicky, I want you to do the copper orally and do the cream on the shoulders and your joints and stuff. Let's build the energy back up, because what I've learned is if you can bring the copper back up, the bugs can't live. Does that make sense? If you have enough energy in the tissue, the body will take care of itself. So one of the biggest things I've learned in all this whole thing last 15 months is that if I can bring the energy up, Lyme can't live in the joints. We'll talk about that tomorrow morning. So that's what was happening. I get Vicky on the table, and I say, Vicky, yeah, I got a bug back there again. But she wasn't making any energy in her joints. I said, well, Vicky, did you do the cream? And she says, it was kind of a pain in the butt, and, it took too much time, and the 17-year-old kid's on a cell phone. I'm not kidding. Mom, it takes like a minute. So she's like, shut up. So here's what was interesting. I'm going to end with this, and I'll show you what happens here. Is that we found that you really want to work on the joints transdermally. And the reason I believe this is because the body's priority system is always your vital organs first. Does this make sense? And the biggest users of copper in the body, I believe, are the heart, the liver, the brain, and the kidneys. And so her body was trying to fill up the vital organs. Once that mineral crosses in the bloodstream, you can't control where it's going to go. The body has its priorities. Does that make sense? So after 15 months, after a year on some patients, I can tell who's using the cream and who's not using it because there's no change in energy to the joint. Does that make sense? So back up for me here and push up for me. Push up. It's crazy, isn't it? Can you hold me? Yeah, no problem? Yeah. That's how fast, push up for me, it turns the muscles back on. Isn't that crazy?
Yes. And what's in a cream?
Love. So we do the research on collagen. We put in there everything that was required to regenerate that tissue. And I can't tell you why it works that fast. Is it a dermal thing? But as you know, DMSO drives things in. It's illegal to take it orally, but it's okay to put on topically, but it really drives it in. And 4 to 6 months out, we see most of the body turning back on because I want you to hold that hip where it's supposed to be, that shoulder, so you don't rub it up on the edge there like you're driving your car misaligned. It's really hard to put rubber back on a tire, isn't it? And it's even harder to put cartilage back on a joint because there's no direct blood supply to it. Does that make sense, guys? So here's the deal. I'm done with you. Yeah, you can. Isn't that cool? So,
Once you go to it, you have to use the cream forever? I mean,
yeah, I think because of,
we'll never make it to the...
so I tell people, and 4 to 6 months, if you can do it twice a day, and I'm asking for 2 minutes of your day, but when I put it on the bottom of my feet, around my knees, onto my hips, shoulders, elbows are a big one for a lot of people. They try to grab something that just hurts in the elbow I'm talking about, and they get that carpal tunnel going on, or, you know. So, and people ask me, where should I put it? I said, just put it on the joints that you want to keep. Don't worry about the rest of them, okay? And then maybe once a day or 5 days a week. And I think that if we can control the glyphosate this way and put the mineral back in there, it's really stabilizing. And I've seen a huge. So what I did is I brought 48 along. They're free today. If you want one, grab one. I got a sheet back there. We got a small company, not a big company, but we're trying to find, it's called Regenex, very funny, your regenerative soil stuff. Our company's called Regenex Naturals. We're trying to help build small products that will help everybody out there not have to lose a hip or a knee. And then the other part of it is why does the brain fail first? Real quickly, I'll get done talking here. The brain uses 10 times the energy in a resting position as your muscles in your legs. You guys know that? 10 times the energy. The heart uses twice as much energy as a muscle sitting in a resting position because it's got to never stop 24/7. So when we lose energy to the brain, even at 5%, so it goes up there. If I can stop the energy being made, I get in big trouble, okay? So we're going to try to develop products for that too, because by the time you start seeing memory loss, you're a long way in the wrong direction, a very long way in the wrong direction. So there's 48 creams back there. We have little sheets back there. If you want to look at our website, I'm going to talk to them around Lyme disease and kind of give you some ideas of what's causing that.
What's the website?
It's a sheet back there. We should have enough for everybody. There's 48 creams back there. If you have any joint problems you want to try it, grab one. You guys, thanks for your time today. I really appreciate coming out here and just talking to you guys and trying to connect some dots, if that makes sense. Yeah, thank you.
Thank you. Thank you, Doctor. Appreciate it. Awesome. Let's go ahead and take a quick 5-minute break, and we'll have Dr. Tom Dykstra.
We're so glad you enjoyed this installment from our in-person conference. We want this to reach as many people as possible, so we've decided to release this free to you bit by bit every month. But imagine how awesome it would be in person. The networking, questions, and discussions that result are equally as valuable. Join us next year in person for our 2026 conference. Your presence makes the experience. If you have any questions or needs, please reach out. Call, email, follow. We can help.